Valley fever is becoming increasingly prevalent throughout California, raising significant concerns among public health officials. In a striking announcement, the California Department of Public Health has indicated that after an unprecedented surge in 2024, the risk of valley fever remains alarmingly high as we move into 2025. Dr. Erica Pan, the state public health officer, emphasized in a news release dated August 14th that valley fever is a serious illness that's here to stay in California. We want to remind Californians, travelers to California, and their healthcare providers to watch for signs and symptoms of valley fever to help detect it early. As of mid-August, over 5,500 cases of valley fever have already been documented in California this year. To put this into perspective, the state recorded nearly 12,500 cases in 2024, marking the highest number ever reported according to the health department. In contrast, from 2017 to 2023, the annual cases ranged between 7,000 and 9,000, highlighting a concerning upward trend. While the southern San Joaquin Valley is the epicenter of valley fever cases, there is a growing number of infections in other regions, including the Central Valley and the Central Coast. So, who is particularly vulnerable to this disease, and what symptoms should you be on the lookout for? Valley fever, also known as cocci or coccidioidomycosis, is an illness caused by a fungus that resides in the soil in certain areas of California and the southwestern United States. The California Department of Public Health explains that individuals and animals can contract the disease by inhaling dust that contains this fungus. The infection primarily targets the lungs and can manifest symptoms that are quite similar to those of COVID-19 or the flu. Common symptoms of valley fever, as outlined by the Centers for Disease Control and Prevention, CDC, include a persistent cough, fever, chest pain, fatigue, or an overwhelming sense of tiredness. Valley fever derives its name from California's San Joaquin Valley, where it is most frequently reported. The counties most affected include Kern, Kings, San Luis Obispo, Fresno, Tulare, Madera, and Monterey. The state health department warns that anyone who lives, works, attends school, or travels in areas where valley fever is prevalent is at risk of contracting the illness. According to the CDC, certain groups are at a heightened risk for valley fever, including individuals with HIV/AIDS, organ transplant recipients, those taking corticosteroids or TNF inhibitors, pregnant individuals, diabetics, people over the age of 60. Interestingly, research indicates that Black and Filipino individuals are at a greater risk for valley fever compared to other demographics. A common question arises: is valley fever contagious? The CDC clarifies that valley fever is not contagious and cannot be transmitted from person to person or from animals to humans through respiratory means. In extremely rare instances, an infected wound could potentially spread the fungus to another person, and there is a slight chance of transmission through organ transplants from infected donors. What about our furry friends? Dogs are indeed susceptible to valley fever, but it's important to note that the infection cannot be passed between humans and animals, given that the fungus responsible for valley fever is naturally found in the soil of endemic areas. Avoiding exposure can be quite challenging. The CDC is actively researching a vaccine aimed at preventing valley fever with minimal side effects, but as of now, no vaccine is available. To reduce your risk of contracting valley fever, consider these recommendations from the CDC. Steer clear of dusty environments, such as construction sites. Wear a properly fitted N95 mask when necessary. Stay indoors and keep windows shut during dust storms. Limit activities that involve soil, like gardening. Utilize air filters indoors to minimize dust exposure. Clean any cuts or skin injuries thoroughly with soap and water. For those at increased risk due to underlying health conditions, healthcare providers may prescribe antifungal medications as a preventive measure. Do you have questions about life in California? Our guide, How to California, is designed to assist you in navigating life in the Golden State, covering everything from state laws to culture and recreation. Feel free to submit your inquiries through the form provided or reach out via email at howtocalifornia@mcclatchy.com. Angela Rodriguez, a service journalism reporter for The Bee, holds a bachelor's degree in journalism from Sacramento State. During her studies, she contributed to the State Hornet, focusing on arts and entertainment.